Nearsightedness. Myopia, often known as nearsightedness, is a common cause of impaired vision. Myopia causes fuzzy vision when it comes to distant objects. It is sometimes possible to develop strabismus, or limit the eye's ability to see clearly. Myopia is a vision impairment, not a sickness, and in certain situations, myopia is the outcome of another illness. Myopia signs and symptoms. Myopia produces hazy vision, and myopia sufferers experience a variety of symptoms. 1. Myopia symptoms in general. The following symptoms are common. Trouble seeing far-away objects. Inability to view a tablet, television, or movie screen. Seek refuge in school, athletics, or the workplace. 2. Children's symptoms. Children under the age of 8 or 9 are often unaware that they have difficulty seeing distant objects. Short-sightedness may be suspected by parents or teachers if the child. His eyes turn or shrink. Keeps books or things in close proximity to his face. Sit in the front rows of the classroom or theater, as near to the television or computer as possible. He is uninterested in sports or other hobbies that necessitate good long-range vision. He has headaches now and again. Myopia causes and risk factors. Myopia is more common in the following groups. People who have a history of myopia in their family. Women are more prone to severe myopia than males. Myopia is particularly common in premature infants, especially those with retinal illness of premature infants. Myopia is made more likely by some genetic eye problems. Working from a short distance, such as reading, has been linked to the development of myopia and its prevalence. Complications of nearsightedness. Myopia complications include age-related macular degeneration, detachment of the retina, the cataract. Glaucoma is a condition that affects the eyes. Myopia is diagnosed. A routine eye checkup can detect nearsightedness, as well as other vision disorders and diseases that damage the eyes. The full evaluation takes between 30 and 60 minutes to complete. A routine eye exam includes the following. Questions from the ophthalmologist about the patient's medical history and the examination itself. Visual acuity, visual field, and refraction are all checked during a vision examination. Slit lamp examination, a microscope is used to examine the eyes. Tanometry is a test that determines the pressure inside the eye. Ophthalmoscope. This is a device that allows a doctor to see behind the eye. Early detection is crucial. Any general physical examination done in childhood includes a routine test of the capacity to discern details and shapes effectively. A screening test for children under the age of 5 is required to detect eye problems such as amblyopia, strabismus, and poor vision. Treatment for nearsightedness. Although myopia cannot be cured, medication can help people acquire normal or near-normal vision and overcome their condition. 1. Conventional therapies. The majority of persons with myopia wear glasses or contact lenses to correct their vision. This is the widely acknowledged treatment for myopia. However, myopia can also be treated surgically. The light is focused back onto the retina via corrective lenses. The majority of persons with myopia choose to treat their condition with glasses or contact lenses. Both are safe and effective, as well as less risky and costly than surgery. Some people claim that spectacles do not provide as good central or side vision as contact lenses, and that contact lenses, while providing superb eyesight, can also spread diseases. As a result, it must be cleaned and maintained on a consistent basis. 2. Surgical intervention. There are various surgeries that change the curvature of the cornea, including laser subepithelial keratectomy, LASIK, surgery to implant rings in the periphery of the cornea, and intraocular lens implantation, IOL. Surgical operations may be affected by certain conditions and drugs, such as autoimmune conditions, immune system disorders, some drugs, people who have had glaucoma, keratoconus, inflammatory eye illnesses, keratitis as a result of a herpes simplex infection, and previous eye traumas or procedures. How to pick the best treatment. There is no single treatment that is appropriate for all people with myopia. However, it is important to consider the following factors when selecting the best option. Can treatment outcomes be predicted to some extent? How stable and consistent will the therapy results be? Will the reform evolve in the future? What are the possible dangers and repercussions? How much upkeep and personal attention is required? How relaxing will the procedure be? What effect will it have on the outside? The most common laser operations to correct myopia cause permanent changes in the eye that are irreversible. However, the most current and advanced methods, such as surgery to implant rings in the periphery of the cornea and implantation of lenses inside the eyes, can be removed if the need arises. How much does therapy cost? Is it covered by medical insurance? What are the risks of delaying treatment? Will therapy have an impact on job or professional advancement? People who participate in contact sports, such as boxing, American football, wrestling, and martial arts, are at risk of receiving blows to the head, face, and eyes, so the doctor must determine the best course of action. Nearsightedness prevention. Although myopia is simple to treat, there is no way to avoid it or keep it from worsening, and in most cases, myopia worsens until the teenage years.